Okay, so I'm here with Jerry, and Jerry, we've been seeing you for 3 months
Three
now,
months.
right? And we just talked about just briefly, some of the routes that you'd gone before you had seen us. You had seen a podiatrist before the Northwestern physician, correct?
Yes, that's correct.
And the podiatrist had what did they do? What was their treatment for your neuropathy?
Gabapentin,
Okay,
and I just did that for, well, probably a couple of months, I'm guessing, and that really didn't seem to do anything.
didn't help you. Okay,
No.
and then you had seen a neurologist from Northwestern, and this was interesting to me because this isn't usually the route that they would go, but what do they do for you?
Yes, this doctor is supposedly one of the gurus in the in the country for chemo-induced neuropathy,
Hmm.
and she had me on these 5 different supplements, over-the-counter things,
Hmm.
and I was on those for a couple of months probably, and I really started to think maybe there was an improvement. Maybe it was wishful thinking, I don't know. But then I had another cancer issue come up, and there was a conflict between the chemo that I had to go on and the supplements. So the supplement thing went by the wayside.
Okay. So now it's been 3 months with us, and you were kind of sharing a couple of the things that the changes that you've noticed. One you had mentioned about your massage therapist. Tell us a little bit about that.
Oh, previously my massage therapist would work on my feet, and I had no feeling in the feet basically. Uh, but now, I was just there last week, and she was working on the feet, and I could actually feel what was going on, not just pressure, but actual sensation, especially in the toes and the balls of my feet.
Yeah.
And now it's interesting because with having that feeling, I'm learning to walk again.
Yeah.
Previously, I would shuffle on my heels.
Yep.
But now I'm making an effort to learn to walk again, more rolling towards the balls of my feet and the toes.
Yeah. And we had talked again about your balance. Tell us a little bit about that.
I'm working very, very hard at getting the balance back, and that gets interesting at times because here, like I said, you shuffle on your heels. Well, that's the balance. Now, being on the toes and the balls of my feet again, it's different.
It's a little different from how
And
you're used to walking.
yeah, you
Yeah.
have to learn to walk again correctly. I make a definite effort, like when I'm cutting grass, pushing my lawnmower, to not just shuffle, but actually pick the feet up and push off with the toes and whatnot in my feet when I walk.
And that was something that you weren't you weren't
No.
either able to or you weren't aware enough to do that before.
Yeah, there was no feeling at all before.
Wow.
It was like 2 tree stumps.
Wow. So now you could feel more even as you're cutting your
Yes.
lawn. Yeah. Last question. So your situation obviously came on from chemo. You'd had several bouts with cancer. What would you say to, a patient that maybe is watching this and, they've been told by their doctor, hey, this is just kind of comes along with the territory. There's nothing we could do. What would you tell them?
I would ask them to get a second opinion on it,
Yeah.
because for me, this has worked. Maybe for others it wouldn't, but for me it has worked, and I'm very thankful for that.
Well, we're thankful for you. Last thing that I want to ask you, because I think this is important. What are your thoughts around this? Like, you wouldn't have come to us if you didn't believe that something could be done, right? I think that maybe some patients have been told by their doctors that there's nothing that could be done. What, you know, what are your thoughts around neuropathy and this condition in general?
Well, a lot of it is attitude.
Yeah.
Some people, they have a difficult time accepting their own mortality, but once you know what the drill is going to be, what quality do you want? Now, I'm almost 80, I'm right at 80.
Yeah.
And for me, I still stay active. I'm up at 0530 every morning, and I'm going constantly. and the quality is back because there are now things that I'm able to do again physically that I couldn't do before. So do you just want to sit there like a mump, or do you want to get out and do something to improve your lot?
Yeah. And that mindset is the reason you're going to continue to make progress.
Oh, for sure.
Yeah. Yeah.
For sure.
Yeah. Well, it's been our pleasure, and we look forward to doing even better than we've done.
Okay.